Hello everyone, I hope you are doing well. Now today I am here with another video, that is questions that can be asked from the submandibular ganglion. In my previous video we have already covered the anatomy of submandibular ganglion. So as I promised that the next video will be the questions on this ganglion. So today I am here to discuss all those questions. If you have not gone through my previous video, kindly go through it so that it is easy for you to understand the various questions and how to answer them in a precise manner. And if you like my videos, kindly press the like button and subscribe my channel. Now, not wasting any more time, coming to the questions. Now today's NMC pattern says that we have to ask various MCQs, the various problem-based questions and reasoning questions. So starting with the problem-based questions, it can be asked like a patient comes with dryness in the mouth, that is reduced secretion of saliva in the mouth. And on investigations, it was found that secretions from the submandibular gland or the sublingual gland or both have decreased in quantity or are absent. Now, answer the following questions. Which is the ganglion involved? So, it is a very easy question. From this diagram, you can answer all the questions. You know that it is a submandibular ganglion that is involved in supplying the submandibular gland and the sublingual gland. Now, another very important question is, which part of the autonomic nervous system is responsible for the secretion of saliva from these glands? Now, as we have already discussed, that autonomic nervous system has a parasympathetic component and a sympathetic component. Now, it is the parasympathetic component which is secretomotor. That means it is responsible for the production of secretions. So, it is this parasympathetic component which is responsible for the production of the saliva from submandibular gland and the sublingual gland. Right? Another question can be, which is the parasympathetic nucleus? So we discussed it in the previous video also. The parasympathetic ganglion is the submandibular ganglion, and the parasympathetic nucleus that is responsible for the secretions is present in the pons, that is the superior salivatory nucleus. Superior salivatory nucleus, and it is there in the pons. And how are the secretions? Means how is the parasympathetic route carried? So we have the whole discussion. The preganglionic parasympathetic fibers run through the chorda tympani nerve, which is a branch of the facial nerve. This chorda tympani is joined by the lingual nerve, which is a branch of the mandibular nerve, and then they carry, this lingual nerve is carrying the preganglionic parasympathetic route to the submandibular ganglion, where the relay is occurring. After the relay, the postganglionic fibers arise and then they supply the submandibular gland directly, right? But for the sublingual gland, what happens? These postganglionic fibers, they leave through the route through which the lingual nerve is suspending the ganglion and then finally reach the sublingual gland. So this is how the preganglionic parasympathetic fibers relay in the ganglion and supply the two glands. I think this is very clear. It should be very clear. Otherwise, you can go through my previous video in which I have explained in details how this supply is occurring. Okay. Anything else? Yes, there can be another question, that how is this ganglion related topographically and functionally? So topographically means according to the location. According to the location, this ganglion is related to the lingual nerve, as we can see very clearly. But according to the function, that means the fibers of preganglionic parasympathetic route travel through which nerve? And that is your chorda tympani branch of facial nerve. So chorda tympani is carrying the preganglionic parasympathetic fibers. So we say that this ganglion is functionally related to chorda tympani, whereas topographically it is related to the lingual nerve. Okay, now the next part, the sympathetic part. What about the sympathetic part? Which is the spinal segment from which preganglionic fibers are arising. Preganglionic sympathetic fibers are arising. So it is from the T1 spinal segment. Lateral gray column. This is a lateral gray column of T1 spinal segment. Then, which is the ganglion in which the relay for the sympathetic root is occurring? I have always told you that for the sympathetic system, the ganglion occurs in the superior cervical ganglion of the sympathetic chain. The relay occurs in the superior cervical ganglion of the sympathetic chain. The relay is not occurring here. In this ganglion, it is a peripheral parasympathetic ganglion, and the relay will be occurring only for the parasympathetic root, not for the sensory root, not for the sympathetic root. So from here, we'll say that the postganglionic fibers, they travel and form a plexus around some artery. Now close to the submandibular gland, you have the facial artery. So they will form a plexus around the facial artery. So you can be asked another question that the submandibular ganglion is related to which artery. You have to understand these questions. One is nerve, one is artery. You can be asked that submandibular ganglion is topographically or functionally related to which nerves. In that case, you have to write about these nerves. Whereas if you are asked that to which artery is the submandibular ganglion related, then you have to write about the facial artery. Because the sympathetic fibers, the postganglionic sympathetic root is forming a plexus around the facial artery and then passes through the ganglion without relay and supplies the submandibular ganglion and again in the same way to the sublingual. And regarding the sensory component, one question is asked that which nerve carries the sensory fibers or which nerve carries the sensations from the submandibular gland and the sublingual gland, and the answer is very simple, that is the lingual nerve. That is the lingual nerve. It is not the chorda tympani nerve. The trigeminal nerve or the fifth cranial nerve is the main sensory supply to your complete head and neck area, right? So we have to find out the branches of the trigeminal nerve. The one that is related to the submandibular ganglion is the lingual nerve, which is a branch of mandibular nerve. So this lingual nerve is carrying the sensations from the submandibular and the sublingual gland. The sensations will go through the lingual nerve. They will not relay in the ganglion, pass up through the lingual nerve, then the mandibular nerve, the trigeminal nerve, and to the higher centers where the relay station is the thalamus, and then finally to the sensory cortex of the cerebrum. So, various MCQs can be asked regarding this topic. It can be asked that where is the submandibular ganglion present? So you should know it is present on the hyoglossus muscle. It can be asked to which part is the submandibular ganglion superficial, to which part of submandibular gland. So you should know that it is superficial to the deep part of the submandibular gland. It has a superficial part and a deep part. It is present on the deep part of the submandibular gland. Then various questions related to it, like it is supplying which glands, the preganglionic root comes from which nucleus. You have the superior salivatory nucleus, through which root of the facial nerve, it is the sensory root that is known as the nervus intermedius, through which branch of the facial nerve, the chorda tympani. Chorda tympani is joined by the lingual nerve, and the lingual nerve is the nerve that is suspending it by two roots, that is the posterior and anterior. Similarly, about the sympathetic, where is the relay occurring? Superior cervical ganglion, and then the fibers travel, the postganglionic fibers travel and form a plexus around which artery? It is the facial artery. Then the fibers pass without relay. So the simple thing is that if you understand the basic concept, if you understand how to draw this diagram and what are we trying to show in this diagram, you can answer any kind of questions. right? Similarly, you get another type of questions, that is reasoning based questions, that how you have to explain why. For example, it can be said that in case of facial nerve paralysis, or in case where the chorda tympani nerve is affected, there is dryness in the mouth. So again, what you have to do is you have to explain this pathway, the parasympathetic secretomotor pathway. So if the chorda tympani nerve is affected, obviously the secretomotor route is affected, leading to dryness in the mouth. It will not lead to total loss of secretions, because you have another important gland, the parotid gland, that is contributing a lot to the saliva. But yes, the secretions from these glands obviously will be affected, right? So this is how the questions come from the submandibular ganglion. And if you like this video, if you have understood this topic, please like it and subscribe my channel. I'll be regularly posting videos on another topics. And besides the ganglion, I'll be posting the topics on the videos on another anatomy topics also. Thank you so much for your patience.